Infectious disease expert, Dr. Manoj Jain is here. Dr. Jain, always glad to have you back on Live at 9.
Alex, glad to be here.
How alarmed should we be about this new information out there, especially mothers?
Yeah, I think we need to put this study into perspective.
Okay.
The risk of autism in the general population is about 1 in 200.
Okay.
What the study found was that mothers who were at the time of pregnancy developed a high fever, which was similar to a flu-like illness.
Right.
In them, the risk of autism was about 1 in 100.
So it doubled the risk.
It did double the risk, but we don't know if it was a causal relationship or was it just an association.
Oh,
and that's
gotcha.
hard to determine. So one cannot say that if you're a mother and you develop the flu, that your child will have autism. In fact,
And conversely, if you get the flu vaccine, your child won't have autism.
correct.
So on the other side of it, a lot of people are probably listening and saying, all right, what about whether or not one should each year get that flu shot? How does that kind of play into this picture?
So I think that's very important to bring into play here because all pregnant women should get the flu shot. We know that it decreases complications. We know that it decreases complications of pneumonia. And I can tell you a story about a friend of mine who was pregnant and she hadn't received the flu vaccine and she developed a flu-like illness. She almost developed severe pneumonia and had to be hospitalized.
Wow.
And that could have been easily prevented if she had the vaccine.
Is there any pregnant woman who should not receive the flu vaccine? Or is
No,
there anyone who should not receive the
Right,
flu
so
vaccine?
right now the recommendation, obviously, anyone over the age of 6 months should receive the flu vaccine. There's ample vaccine for a large number of the population.
So even if you're in the because you know how pregnant women are,
Right.
especially if it's your first,
Yep.
you don't want to breathe around people sometimes. So even if you're in that very first tender few weeks when the fetus is just beginning?
Absolutely. All of the pregnant women should get the vaccine.
Okay.
Talk to your doctor. Make sure that, obviously no allergies to the vaccine or previous complications.
Right.
So, barring those issues, they should definitely get the vaccine.
Okay. Sounds like everybody should.
Yeah, it really
and now we have various other types of vaccines available rather than the shot.
Are they just as effective?
They are as effective.
What are some of them?
So, there's a new one which is intradermal, which is just underneath the skin. The needle is about 90% smaller than the muscular injection.
Okay.
And those are effective. We have the nasal one as well. Now, mind you, some of these are not recommended for pregnant women.
Right.
But for the general population, I think we have so many options that there's no reason not to get
And
the
it's
flu vaccine.
covered, right, 100%, so it doesn't cost.
Right.
So,
All right.
all right.
Dr. Jain, thank you very
I'll
much.
go today.
Very good information.